good morning, or I will say, and thank you for the, do you hear me there back? Yeah, very good. Thank you for the invitation. It's very nice to be in your country, at the moment especially. The weather is fine and fantastic place, and I was very impressed about the discussion which already started, because in Linda's and was it Jiri, their speeches and other ones which I heard, there's an approach which has a seriousness here, and it's all the most important elements, I think, which also Catherine took up in many points. You can see from very quickly, is there a seriousness, a real target in the beginning, or is it more or less a very good, eager to start to solve the problems, but not a vision on how to do it. But I'm sorry about this language, first of all. Your language is very near Finnish, you know. It is, in fact. You could learn it, certainly, if you would try to. Because, for example, sociaalinen asuminen, sociální, bydlení, how do you call it? Sociaalinen asuminen. So there is a little bit difference, but anyway, it's very near. You can almost understand that. Okay, this is very good. I've been working with the homelessness issue. I've been responsible for the national homelessness policy in the government from 2001. I came in the ministry as a one-man's committee to make the presentation for the whole Finnish housing policy for 4 years, in the beginning of 2000, so until 2003. So I learned very much how the state machine works, in fact, and it helped to also to use the knowledge in reducing homelessness policy. But at the moment, I'm, as you said, Stefan, I'm retired from 1st of July, but I'm still working with the Prime Minister's working group on inequality in Finland. There's a group, I'm a background special advisor working on helping and writing the text concerning housing and homelessness. So it's important that you can continue. And it's true, I'm writing a book on the Finnish after-war homelessness policy, because we don't have it. And somebody has to write it now. And make some kind of first presentation and for the forthcoming generations. That's very important. Before I start, sorry about this, I would say that there is no possibility to copy anything and transfer it to other contexts. And you know it. All the things which I now tell you, we have used international, for example, the US experience on housing first, and every good ideas and promising services and models, we have tried to use them in every sense, steal them as somebody says. You have to steal from everywhere, all the time, and be open. If you don't steal, you lose. In fact, you have to do it, otherwise you can't test and pilot the best of everything. But you cannot, that means also that there are the differences that you can, in a way, learn from approach to something, as I said, and learn from the concept, some of the elements in the concept, for example, in Housing First or other ones. But then it's up to you, it's the application which differs. The way you go to the details, what are the players, the stakeholders, how do you work with them, what is your timetable, and especially what is your resources, your financial, your mental resources, your courage. You cannot transfer them. absolutely. In many cases, I've been now discussing, I would like to see how it goes on. They invited me to start to be part of the British government's new homelessness and social housing strategy. And the ministry said he visited in Finland Mr. Javid, which is responsible in Theresa May's government, said that yes, you should come in now in the advisory panel. And I was very proud on it, but I said also that you cannot, you must see that anyway the resources which the British government puts in is the crucial here. You have to start with the credible, believable. You have to believe in yourself. You have to have a confidence in yourself and put enough money for a long-term commitment. And as you know, the British, they are very pragmatic and quick. Oh, okay, we take 2 years, 3 years, we put up a project here, and then they're going and trying to solve the problem. And in many cases, it doesn't work. As we see, it is a long way to go. And I was very pleased when the Conservative manifesto said that the rough sleeping, their idea is to put the rough sleeping, to put it down to half in 5 years and until to 2027 to get rid of rough sleeping. That is the good perspective. If you put resources and you start to work. And so we're going to see, it's very interesting now that their opening is also on social housing. As you heard, perhaps it's the green paper on social housing, which they are now trying to produce in Britain. So it's going to be interesting. And if I have a role, we try to help naturally them and transfer all the best things which we learned in Finland. So now we trying to go to the.
This is your presentation.
This is a new.
And I will give you this.
Okay.
So you just click, yeah?
Yeah. You know, this is the first time that somebody has beforehand, translated to another language. So it's, I don't know how it functions. Do you know? It doesn't? Yeah. And now we see it. Okay. I have to keep up that I understand something, that I'm not talking about some other, slide. Okay. So as you can see, yeah, it's true. It's the presentation here, which I'm not going through all it. We have a meeting with in the other rooms in the afternoon. I will go more to the details with some pictures also from my forthcoming book. I can now market it already in the afternoon. Is it afternoon or in the round one? Yes. So I go deeply on the issue of the critical turning points or the systemic change in the other presentation. I'll take some of the elements here which I have the time. Is it up to 11, or you think? Yeah, you have to say that you stop now. Okay, that's good. As you can see, I start with the necessary elements in effective strategy, go to some of the approaching concerning the transformation. What do you need, or what is our thinking, the way of our thinking, or which elements, which we've stolen from the Dutch people. Then we have the critical turning points, which I'm going quite fast and come back to it. Then it's naturally all the most important, the commitments to transformation and the central results in the end. And this comes now the idea that, if I go forward, yep. As you can see, there is, I think, our experience also, and I think all around the world, tells that you have to have all these elements in an effective strategy. Otherwise, you cannot succeed. They have to be in balance and use them interconnected all the time. of the experience which you get. And I put it in some of the order here. The housing first is naturally for the most complex problems, to solve them, the rough sleeping, the long-term homelessness, very severe, high need of support, intensive support, as you know. It is a special, very good instrument, absolutely a real social innovation in many years. And thanks to Americans, it's a very good, the New York model. We don't copy it directly. We try to use the best parts of it, because New York, for example, at the moment is in real troubles with homelessness, as you very well know. So you have to keep it relativity here. Okay, the second element is the prevention of homelessness. Naturally, it's for more or less, there are lots of persons in South, because the homelessness issue is a very heterogeneous group. It means that there is a big group of people which are only in lack of affordable housing, or which can manage with housing with quite light support. Housing advice, housing counseling, different kind of things, how to live in a house, etc. They don't need the intensive support. So you have to have different approaches for different needs. And that's the real challenge in homelessness policy. And then is the third one, which is coming up also, and your approach. It's a question that you develop a very diversified supply of new and existing rental accommodation. It means more and more diversified in a way. But there's an important one, which I think was being one of the driving forces in our Finnish policy, is that you have to all the time compare the idea of different solution to the principle of normality. You try to get nearer and nearer the normal way that the population in Czech or Finland or wherever they live. You have to have it. Otherwise you're in problems with all and more very detailed different kind of solutions. And it gives a problem in your whole housing stock and the new housing production, because you have to have, it has to be used in future history in many different purposes. It can be in the beginning a youth housing place, but it can be solved also to migrating people from different ethnic backgrounds in the future. And as you understand, the housing stock have to be very flexible and usable for different purposes. So it's very important that we follow so much close that we can the principle of normality. And also the basic naturally human and social rights, the right to housing, etc. But anyway, so we need all these three. And it's several countries, which are with the housing first, but they are not working with, for example, affordable housing and housing supply. And you cannot go with the housing first and not increasing the supply of social housing. Okay. That's about the basic here. This is the basic principles of housing first in Finland, which we have developed. I think we have 4 elements. I'm not going in all details here, but the first one is naturally the making the independent housing possible. You have to do it in many ways, and it's very important, this rapid housing, as you called, the direct access from the street. It is a safe haven, a place where you can get rest and go forward in your life and start with the rehabilitation and different training and work and etc. But you need the permanent place. It's a place of your own. You have to have a tenancy agreement, absolutely your own independent. It's not a question of hostel or shelter living, which is not based on the rental tenancy agreement, as you very well know. You can be thrown out whenever, and it's a question of security. Then is the other element is the choice and self-determination. It's a question that you have to have the right to be part of what kind of support and when and how it will be organized in your life. Make a common plan for your own life together with the social workers or other support persons which are with you. And the third one is the rehabilitation empowerment. It's the question, I think this is one of the most important, that somebody, was it Chiri or Linda, I don't remember, said that the social workers, they are in a very crucial way, how do they work with the clients and the tenants, in fact. And you should develop it. We've tried to use, we stole again from Norwegian authorities a very good word on this. It is housing social work. We put together the housing and social, but it's housing first. It's housing social work. It means a very near presence and dialogue with persons to go forward. And I think this is one of the universal conclusions which you can do in whatever culture you work with. You have to be very near, you have to find the trust with the person. Otherwise, I don't want this. I'm not going to motivate here. I'm not going to do anything. So it demands also much time and a very clever management and leadership to lead it as a whole. Because they're very also challenging clients in many ways, as you know. The long-term homeless in Finland, they use before we made a research on their behavior concerning the social health care, and we counted out that the long-term homelessness in Helsinki city, they used 16 times more hospital services than average population, 16 times more. So you can imagine where the savings comes. Directly when you go to a home-based system with the social workers and you get the people out of the hospitals and don't use it so much, or jails, or different institutions, it's a direct saving in the public finances, in the public budget. So it's very logical. There's no magic here. It is there. Just grab it, as you could say. All right. Then is the fourth element, the integration to society and community. That is very important, as you know, because many of the homeless don't. The best way to survive and come back and the recovery process needs natural networks, family, friends, neighborhood. All the ones have to be. And it's one of the part which I already now want to say, which is one of our very good learnings, is that you have to work when a new housing unit. We have built it during this program about 20-25 new housing units inside many city centers. And we got a very heavy resistance from the neighborhood, as you know. Not here. Not here. Very good thing, but not here. As you know, everywhere almost. Even that the social housing came. It was a rental apartment building. No, the prices of our owner-occupied, flats, they're going down with this new neighbors. There's no evidence on it, as you know very well. There is no evidence on it. So it's very important. The conclusion was that we develop a certain kind of environmental work when we launch a new unit somewhere that we start building or renovating. We tell openly to all the local people, the shops keepers, the firms, the child care institutes, which are there, the neighboring living persons there. We tell them openly that this is a new unit now coming here, and we're going to house this and this kind of persons here. We have plans to help them with this kind of support, etc. And we're going to be in contact with, and it's important that you have to have one telephone or some kind of channel that all the worries, which many of the persons are really worried about, there can be, from, recovery process from drug addiction or alcohol, other mental problems with these persons, as you know. So they're very worried about their children living in neighborhood. So you have to have a phone or a place where you can contact. That is the basic number one. That you have the place, and you listen, you discuss. There's lots of information which you can then deliver and tell. And it's especially Helsinki Diakonissa Institute, which is one of our third sector organizations, and also the Salvation Army. They work very much with this way of method. And it's important also into the step with the integration into the community in the future, because they are also afraid, the persons which are then moving in the new unit, if there is a hostile, environment around. So you need all this one. Do we have still time? Mm-hmm. So we go forward. I have my own. No, that was bad. No, this is not working. Isn't it? Yeah. This is our preventive approach as a theoretical or also evidence-based, and this is not new. We've stolen again parts of here and there, But then we have our, as you can see, the bottom line. That is the best on Scandinavian countries, which I like so much. It's a question of the universal rights, the universal services. As you can see, it concerns the work and income, affordable housing, school, family, friends, welfare services. They are open to everybody. In one term, to say. So it's an important element. But then you can build on it with the more specialized supported housing in between here, and also the early intervention of different forms. And the way we test it, you better with this. Can you follow? Next. Thanks. We test it with this kind of, method. No, it's this one. We tested that, as you can see from the ideas, and is it on the idea or concept level, the certain kind of services. For example, if we take the housing social, for example, the multi-sectoral local housing, that is not good. But if you take a housing included in youth guarantee, well, that is already, the more, the green, the better it's more implemented. The idea is that in many cases, some of the services are in the idea or concept phase. They're not developed. There's no piloting or testing, and there's not put in practice. The experiences are very few, and the scaling and diffusion is in the beginning. So you can test that where are you in fact in real terms with your infrastructure. You can test every method which you use. Is it in the beginning or is it in the end already? It gives an overview of your real knowledge and know-how and resources. I only wanted to show it as a method which helps to go forward. Is it now here? Is this the next? Yeah, very good. Well, this is one of the comparison between what is the change with our long-term homelessness program from 2008, already before, up till 2015. As you can see, you could say that after war, gradually on the left side, the bottom housing market worked like this. There was, the very heavily, very big units of shelters, hostels, night shelters, especially. They were up to in Helsinki. There were about 5,000 beds in Helsinki, still in the middle of 1970s. So there was a huge amount of, these big mass accommodation places or smaller places, but anyway, without any, privacy, etc. And lots of the people at that time still went to work from night shelters. It was a quite big group of. But anyway, all the addiction problems were present. So the bottom housing market worked like shelters and hostels, and we had about 600 outdoor, persons at that moment in Helsinki city, in the capital, and also there was a big group of living in institutions, lack of affordable housing, or any knowledge about where would they then leave from hospital, etc., etc. As you can see, so it was very permanent system inside the bottom housing market. So they went around with this one, taking the other one and moving to another one, but not being capable of moving to general housing markets, to the normalization, to a normal living. As we know, this is only our other way of telling about homelessness, about system. But now, the system which we have changed, I think, which is the very most, for future, it's a real change here concerning, I would say that it's a very clearly a systemic change, transformation. As you can see now, the bottom housing market, part of the new solutions, the independent council housing for long-term homeless, which have increased with the independent housing and youth housing, they're already part of the general housing market, very clearly, very normal way of. But we can then, accommodate more and more persons inside directly to the general housing market, integrate them. But then there's the development these three blue items at the moment, very nearby to be a bridge to get to the general housing market. It's the independent supported council housing, municipality owned. Then there's the question of on the right side, the third sector housing, for example, Salvation Army. You have a small amount, not only a small amount, quite a lot already, or our third sector organizations, we have several of them. And then also the independent supported flats in our congregated, centralized housing units, which we have built. And this is one part which has been discussed quite much in European level. But we've made it in a way that in every congregate unit, for example, in the biggest one is 125 flats. They are all independent flats inside a unit with the common life. And there is a group which wants to live in this kind of housing. It's not the one which we are going in the future increase. It is a way of, I would say it's a transitional situation where we try to help, encourage people then to move to independent supported flats. But it helps directly to solve the open homelessness and get people in a new start with independent possibilities. So they have the possibility and the right to drink, because they have their tenancy agreement. They have the right to drink, but we tried also the harm reduction if the life gets too busy, too wild in the houses. You have to be, and it's the intensive support of personnel. If you have 125 apartments, I'll be here, sorry. If I have 125, flats, it means that we have also in the unit there is 0.5 personnel. It means there is almost 40 to 50 persons working also in the unit. So it is a very heavy investments from the state and from the municipalities from the start. You have to have social workers there, all the ones, the housing counselors, addiction experts, etc. So it requires also resources. Okay. Now, We come to the transformation, which is the thing which I'm going to more detail in the other session going through. But I like about these three elements. It helps to understand what is going on in a very complex world all the time. And you can use this and change the focus or the agenda. You can use it in the climate change or waste disposal or homelessness issue, whatever. I recommend you to learn from the Dutch in this case. It's a very good transformation management theory, a very good one. I like it. I've used it now from 10 to 15 years already in some different things, trying to understand. You have to have the landscape, where the analysis, the diagnose is made. What is going on here and it's many major trends which you cannot directly involve and influence, which you understand. For example, one thing which I said, which I understood very quickly, was that this normalization principle came in Finland through the welfare society in the end of 60s and especially 1970s, 80s. And you can see how much it is this kind of open homelessness in conflict with the normalization, with the basic human rights. You saw it, and it was the real tension in some sense in Finnish, which had an effect that you have to change this. This is not the way that you put people in night shelters. And then you say that, this is an equal society. Everybody understands that this is something false here. This is not working. You understand. You have to look about the trends and look where is the conflict with the prevailing system of, for example, homelessness services. The second one is the dominant system and practices. You have to know it, how the history of it, and it's challenging, replacing, and mainstreaming how to do it in offense. See all the little symptoms already on scene of the new which is developing, and then the most interesting one. And now I have I hope we can future work together with you, although I'm here a little bit older already. But anyway, we have made an application, to the Finnish Academy. On a study, on a research concerning homelessness policy and the systemic change. And it's one of our cities. There is a research group already working. Is San Francisco, in Francisco. The San Francisco, Milano, and Helsinki. We try to compare them. How do they solve and respond to homelessness policy? We hope that we get the money from the academy in spring. And if it succeeds, which I think, which is a very prominent professor group working on it, their theory is this collective transformative agency, which I like. It's a horrible word, I understand. But it's very clever in a way, because the change is in many cases very different in nature, in fact. And in many cases, for example, part of the book I've written out, I can see already that the period from 70s up to the middle of 19th was a very, parallel processes without any major, program from the government. There was a one certain program period, but it was a long period where parallel independent processes went to the same direction and formed this kind of collective, transformation. It can happen also in this way. But again, the long-term homelessness program was in fact already, there was a vision of 4 wise men. Our ministry put a group of wise men. There was no women. I had a phone call when we launched it on Thursday, that this openly to the press. I got a phone call 8 o'clock next morning from an ombudsman for equality. Directly said that, what is this? There is 4 men and no women. We had to little bit think about it, but my minister said that, forget it. We're not going to do any change here. Yeah, he was very stubborn. So, but you can see it's an important thing. Okay. I mean, the vision and the paper and the report of the wise men became crucial. It showed the way to how to implement housing first, and made all the, you know, the action plan in real terms. So it can happen, and it was a very concise, very concerted. Where are we now?
No, it's the transformation.
It's the same. Yeah.
3 levels.
Okay, yeah. It's still, yeah. But I think I've said already what I wanted. I have to. This is long. We could put to the end. We should say 3. Yeah. If you go to the commitments.
The one.
The first. Yeah. Yeah. It's okay. So that's the commitment in your language. I would say that these commitments, 3 commitments which were made in the program to reduce long-term homelessness, which already, it was the vision first of the group of wise men. And then we implemented it, we started to implement, it was a government program. But the first one is that the state, the government, made an offer which you cannot refuse if you work in the municipalities. You cannot refuse. You know, we took responsibility of all the funding, the finance, 100% funding of the new building costs. It meant that it's 50%, when it's a long-term homeless unit you build, you can get 50% investment grant to the cost, because it's much more expensive than normal rental housing to build, because, you know, there's facilities, materials, everything which have to go, which is has to be more durable than normal social housing. So it costs more. And so you need more investment grant to be that the rent is affordable, that the people can also live there. And the other part, the 50%, was a state subsidy loan, interest subsidy loan. You know, the loan comes, the money comes from the banks, but the state pays the subvention in the interest rate. Yep. So it's very common. But anyway, there were no own capital requirement from the municipality or the third sector operators. So it was 100% offered. That was the first, I think, important. And the second was that the Social and Healthcare Ministry gave with the direct grant 50% of the costs of new personnel on the units. Social workers, you know, addiction experts, nurses, psychiatric sector, and all this 50%, you know, it means of the maintenance costs for the 8 years. And we could recruit 350 new persons in these units all around Finland. So it was a real added value concerning the resources. That is the first commitment. It was the government. The second one, do we have it here? Yeah, you better. No, I'm already in the third. Second, it was the contract, the letter of intent which we made with 10 cities. The biggest homelessness, you know, the biggest homelessness is existing is the 10 cities in Finland. And we made a very earmarked contract. It meant that all the money which we gave, I just told you, all the money, we went through all the projects in the negotiations. I led all the negotiations with the 10 cities, and we made a very concrete deal that this and this and this projects will start, and the responsibility of the municipality is clearly written out, and also the new personnel. Everything was in the papers. So it meant that also that to get the money, the municipality had to start very concrete work in their own municipality. And that is very important thing. Otherwise, as you know, if you don't put the money earmarked for long-term homeless, it's very quick that they use it for family issues or for some other healthcare issues. As you know, they have a very big autonomy in Finland, in the municipalities. It's very strong. If you don't agree with them directly, you lose the money. It goes to some other welfare, very good purposes, but not for the long-term homeless, in fact. And it had to be the long-term homeless, not only the homeless. It had to be long-term homeless, and they had to give our evidence to the state that this was really the case. So we followed up it 8 years, all the time. Otherwise, you lose it also. You give money, okay, all right. You give next year money, okay, but nothing happens. That's the worst case, as you can understand. Okay. And then, as a whole, we used for 8 years 240 million euros, 30 million euros yearly for the new housing units and the recruiting of the personnel. So it is an amazing investment in Finnish society, because it went over. We have a traditional 4 years for the government to put, but the political decision was that it was extended to 8-year programs. 2 governments were responsible for it. So it was a different kind of political constellation. Okay, and now the third one, I have to stop here. And the third one is all other relevant factors, It was the service provision and housing assistance with several, third sector operators, research, and especially the networks and the project which was responsible on the development work. There was an independent parallel group working all the time with training, networking, media, all relevant, channels, and organizing all the resources which you have. And you need it, otherwise you cannot, diffuse, scale up the best practices which you learn. So about these, if you put these 3 elements in your country, these commitments, 3 ones, you're going to succeed. Thank you.